Welcome to The Explainer. Today, we're unpacking a medical mystery that traps millions of adults in silent, escalating agony, and that is the frozen shoulder. If you've ever felt this deep, nagging ache in your shoulder that just slowly transforms into a stiff, immovable joint, you know exactly how debilitating it can be. Honestly, it's a condition that robs people of their sleep, their mobility, and ultimately their independence. But what is actually happening inside that joint? And more importantly, how do we fix it?
Here is our agenda for today. We are going to cover 1. The frozen shoulder phenomenon. 2. The 3 stages of freezing. 3. Biochemical and physical causes. 4. Misdiagnosis and chain reactions. 5. The treatment blueprint. And finally, 6. The danger of waiting.
Section 1. The frozen shoulder phenomenon. Unlocking the mystery. Let's just dive right into this. What exactly is happening under the surface when your shoulder just flat out refuses to move? Because it's not just a muscle knot. We're talking about a profound structural change inside the joint itself.
Medically, we call this adhesive capsulitis, and honestly, that name really hits the nail on the head. The core problem here is that your shoulder's flexible capsule, that strong connective tissue that's meant to keep the joint fluid and mobile, well, it literally glues itself shut. It becomes highly inflamed, it thickens up, and it starts laying down these dense bands of scar tissue called adhesions. Basically, it leaves absolutely no room for your upper arm bone, the humerus, to move freely within the socket.
Now, what's really fascinating here is the highly predictable capsular pattern of motion loss. You don't just lose movement at random. Because that thick scar tissue contracts uniformly across the entire capsule, it follows a very strict sequence. It always starts by severely blocking external rotation, which basically makes it impossible to turn your forearm outward. Next, it goes after abduction, meaning you can't raise your arm sideways. And finally, it restricts internal rotation. That's the one that completely sabotages those everyday essential tasks, things like reaching for your back pocket or the ultimate daily shoulder test, fastening a bra.
Moving on to Section 2, 3 stages of freezing, the 1 to 3 year journey. Unfortunately, this is not an overnight issue that you can just sleep off. It's a grueling marathon that progresses through 3 very distinct chronological stages.
And understanding where you are in this timeline is absolutely crucial. Because as you can see, the journey from the initial onset of pain to full recovery can take anywhere from 1 to 3 brutal years if you just leave it unchecked. It kicks off with the freezing stage, lasting 6 to 9 months. This is characterized by severe, nagging pain that usually gets significantly sharper at night, totally ruining your sleep. Then you transition into the frozen stage for about 4 to 12 months. Here, the intense inflammatory pain might actually plateau a bit, but profound, rigid stiffness completely takes over the joint. Finally, we reach the thawing stage. This can take anywhere from 5 months to 2 long years, but this is where the tissue elasticity slowly, gradually starts to return.
Section 3, biochemical and physical causes. Why does this happen? So the big question is, why does the shoulder capsule suddenly decide to attack itself and turn brittle in the first place? Well, the triggers usually fall into 2 camps, highly biochemical or highly mechanical.
Let's look at the 2 most common culprits. First up, diabetes. Folks with diabetes actually face a massive 5-fold increase in risk. Why? Because chronically high blood sugar creates these compounds called advanced glycation end products, or AGEs for short. And these AGEs literally bake into the collagen of the shoulder capsule, causing it to abnormally cross-link, so a flexible tissue turns into a brittle, stiff structure. On the flip side, we have post-trauma frozen shoulder, which is a totally mechanical cascade. Say you injure your shoulder and keep it immobilized in a sling for way too long. Those unused collagen fibers just begin to stick together. The trauma triggers an exaggerated inflammatory response, pulling the whole shoulder capsule tight, almost like a drawstring bag. Let's jump to Section 4, misdiagnoses and chain reactions, finding the true culprit. All of this builds into a massive clinical problem, starting with the simple fact that frozen shoulder is incredibly easy to misdiagnose early on. Because the pain creeps up so gradually, it often mimics other injuries. The most common mix-up is between a frozen shoulder and a rotator cuff tear, but there is a super easy trick to tell them apart. Just have a clinician, or even a friend, lift your arm for you. With a rotator cuff tear, you can't lift the arm yourself because the muscle is torn, but if someone else lifts it for you passively, it moves pretty freely. In a true frozen shoulder, though, even passive motions are completely blocked by that glued shut capsule. It literally feels like hitting a brick wall. People also confuse it with shoulder osteoarthritis quite a bit, but there are distinct clues here too. Frozen shoulder typically strikes folks right between the ages of 40 and 60, and unlike osteoarthritis, which leaves obvious signs like bone grinding, joint narrowing, and bone spurs on a standard x-ray, a frozen shoulder leaves an entirely normal-looking x-ray. It's a soft tissue problem, not a bone problem. And honestly, having a totally normal x-ray when you're in that much pain just adds to the mystery for a lot of patients.
Plus, we absolutely cannot ignore the regional chain reaction. Your shoulder isn't existing in a vacuum, right? If you've got a slouched upper back, your thoracic spine, it forces your shoulder blade totally out of position, which just accelerates the mechanical stress on the joint. Then add in the C5 and C6 nerve roots in your neck. Irritation there can actually heighten how you perceive pain in the shoulder itself. And because you can't lift your arm normally, your brain tells your upper trapezius muscles to just constantly shrug to compensate. Over the course of months, all that constant shrugging creates massive secondary pain, bringing on terrible neck tension and headaches.
Section 5. The treatment blueprint, stage-matched physiotherapy. Okay, so how do we actually fix this? Beating adhesive capsulitis requires a highly strategic plan. You can't just blindly stretch your way through it. The treatment absolutely must evolve right alongside the disease. This stage-matched roadmap is your blueprint. Notice how in stage 1, the freezing phase, where everything is super inflamed, we never aggressively stretch. Seriously, that would just make the inflammation angry. Instead, the goal is purely pain reduction using gentle pendulum exercises and maybe corticosteroid injections. But as we transition into stage 2 and that inflammation drops off, we pivot. We target the stiffness with sustained stretches and joint glides. Finally, once we hit stage 3, the thawing phase, we shift entirely into aggressive tissue remodeling, pushing to the end range of motion to actively stretch out that newly pliable scar tissue and really rebuild your functional strength.
But what happens if physiotherapy just isn't enough? Well, for the most stubborn cases that show zero improvement even after 3 to 6 months of doing all the right therapy, we do have advanced medical interventions. Doctors might try hydrodilatation, which is literally injecting fluid into the joint to stretch and pop that tight capsule from the inside out. There's also manipulation under anesthesia, where a surgeon physically stretches your arm to break those adhesions while you're asleep. Or, as a last resort, an arthroscopic capsular release, which is a surgical procedure to go in and precisely cut the tightest, most restrictive bands of the capsule.
Which brings us to our final section, Section 6. The danger of waiting. Why wait and see is a dangerous myth. Please, whatever you do not fall for the trap of thinking you can just wait it out and the pain will magically disappear on its own with zero consequences. That is arguably the most dangerous misconception out there about this condition. If you delay treatment, you are risking permanent, irreversible damage. That chronic inflammation, it acts just like glue. The redundant fold of tissue at the bottom of your joint, called the axillary pouch, can permanently stick shut, which physically shrinks the total volume of your joint. The scar tissue itself can mature, turning into this rigid, leather-like thickness that just refuses to stretch. Worse still, your unused rotator cuff muscles can undergo fatty infiltration, meaning healthy muscle dies and is replaced by fat. And maybe the scariest part is maladaptive neuroplasticity. Basically, your brain can permanently forget how to properly sequence reaching overhead, leaving you with chronic dysfunction even long after the shoulder eventually thaws. To put that into perspective, just look at these numbers. Real-world studies completely shatter the illusion that this is a self-healing condition. Up to 40% of patients who just wait and see continue to experience persistent symptoms well beyond the 3-year mark. And even more alarming, roughly 11 to 15% are left suffering from permanent functional disability. Choosing to ignore a frozen shoulder is a massive clinical risk, and it leaves a shocking number of people permanently restricted. So, I want you to take a close look at your own movement health today and ask yourself this absolutely crucial question. If your shoulder is feeling stuck, are you taking targeted action right now, or are you risking permanent restriction tomorrow? Is ignoring that stubborn shoulder pain really worth losing your ability to reach, to lift, and to live your life freely? Don't let your shoulder freeze you out of your own life. Get it assessed, get on a stage-matched plan, and reclaim your mobility. Thanks for joining me on this explainer, and take care of yourself.